Hi, my name is Dr. Jamie Jo Studer, and I'm so excited to be talking to you guys today. We're going to have a couple sessions just to talk about STEAM classes, the components of STEAM, and how they actually relate to my job, which you can kind of see on here, Family Dental Health. I am a dentist. I've been a dentist for 11 years. That's how long I've been out of school. I know I'm an old person. And back in the day when I was younger, STEAM wasn't really something that we talked about. I certainly don't remember it. Classes when I was younger, there being a focus on it. That's sort of a newer concept. Getting kids interested in the sciences, engineering. We'll kind of talk about all the different components, how it has to do with my job, specifically in dentistry, but you can also see how it relates to a lot of different career paths out there. Even the art component, and I'll talk about how that's actually very important in dentistry. So we'll kind of kick off talking about that a little bit, and then so today's session, what we're really going to focus on is technology in dentistry. So we will go into that in a minute. I was going to kind of just break down the whole STEAM acronym and just briefly talk about how dentistry is involved in every single one of those and why it's so important. So obviously the science aspect, I'm going to actually have a whole session where we're going to talk about the science part of dentistry. Lots of mixtures and things that all need to be exactly just like a cake recipe to come out the way that we want it to. So we will talk more about that at that time. Obviously, the T is for technology, which we're going to talk about today, kind of how technology in dentistry has changed over the years, especially in the last 100 years. Dentistry is very different than what it was 100 years ago, so you should be very thankful that you are alive in this current time, because it definitely was not, let's just say, very enjoyable 100 years ago to get any dental work done. We'll kind of talk about that. And then, of course, engineering. Touch on that a little bit later, but very quickly, there's a lot of engineering that goes into a smile, into the way our teeth come together, the way we bite come together. When some of you have probably had braces before, or something in the orthodontic field has been in your mouth, a retainer, an expander, some of these things that move our teeth. Well, that's very physical. It's all about physics, engineering, and the orthodontist's huge job is to be the master planner of all that, the master engineer of how everything's going to move around, especially because when it's done in a child, pretty much anybody under the age of 20-21, there is development and changes in the body along the way. So they have to predict all these things, takes lots of measurements to figure out where things are going to go. So again, that's the engineering part of it. Not just orthodontics, but in my general dentistry field, if I'm placing things in someone's mouth, it's all very engineered. So then we'll go on to the next part of the acronym, the arts. Super important, actually. Luckily, I'm a creative person. I like to do things like painting and making things with my hands. I always loved, my dad was in construction and sort of carpentry when I was young, so I loved having him help me with the saw and building things. So naturally, dentistry was a really good fit for me because you use your hands a lot to make things. Luckily, I have very small hands, so they fit in people's mouths very well. And in fact, in college, it was encouraged to take some sort of art class. So I took pottery. I think it was called a ceramics class, but I got to make pottery, which was awesome. I loved it. And who knew that that is a lot of what I am doing in dentistry when I'm making things. So I'll show that in some of the sessions. I'll show little things that we do in the lab that actually do require lots of skill with your fingers. And then, of course, last, math. We're actually going to have a session talking about math. It's not necessarily everyone's favorite subject. Luckily, I'm a nerd and I love math. So we are going to talk about a couple things to do with that. I'll give you some little problems to work through and show you kind of how we do that day to day. All right, so one of the very first technological aspects of dentistry is x-rays. So most of you in the room, if you've been to the dentist, have probably had some of these, and excuse me for my shaky hands. I'm trying to hold this to get those. So these are actually my x-rays that are in our system. So that's just showing my teeth. And as you can see, I'll kind of see if I can zoom up here without it getting crazy. Sorry, the lighting's kind of changing. But what we're basically looking at is in between the teeth. And these are things that a lot of times, right where the teeth are touching each other, which is where you're supposed to floss, we can't see that in the mouth unless there's an incredibly large hole. So you can see where all those teeth are kind of touching next to each other. That's why we take these x-rays, so we can see in between there. And I'm sorry, my mouth is boring. I have no cavities, so there's not much to look at in my mouth. But when you guys come to the office, we'll kind of look at that, and I'll show you some things. But that's why that is a super important part of technology. X-rays were basically discovered, we'll just say approximately 100 years ago, and that's been one of the biggest technological advances in dentistry, because then we can actually jump in and do treatment before it turns into something crazy. So back in the day, when x-rays first came out, they did expose a lot of radiation to the patient, but mostly actually to the doctor. And they didn't know about putting a lead apron on. The lead apron is actually very heavy, and it helps make the radiation not penetrate the patient, because all we want is the little spot that we're putting the x-ray head. But we also don't want it to penetrate the provider who's actually taking the pictures. So that technology has advanced a ton. Now it's digital. There's barely any radiation at this point, so you actually get more radiation just from walking outside in the sunshine for a few minutes than getting a few dental x-rays a year. So now it's very, very safe, and then again, it helps us find a lot of information out, because we cannot diagnose, which means that we cannot basically come up with the treatment of what's going on if we can't see it. If we're just looking in with our eyeballs, we're only seeing a very small part of the picture. Now in this next section, I'm actually going to show you a couple patients who actually we diagnosed perhaps pathology, which is sort of the study of disease in the body. So oral pathology is where there's pathology somewhere kind of in the facial region. Very, very interesting part of dentistry. Many times a patient may not know that they have some sort of pathology going on in their mouth, in their throat, somewhere in the skull structure here, until we take an x-ray. And a lot of times we don't see it on the little bitty ones that I just showed you. Those are called bite wings. We take the big panoramic one that goes, some of you have probably had that machine that goes around your head, and it basically gets every structure from here to here. And we actually can find a lot of bony pathology, soft tissue pathology, all that we can actually see in there. So I'm actually going to show you a couple x-rays of some pathology, just so you can see kind of what that looks like and why it still is important, every few years to be taking a picture like that, because not everything has symptoms. A lot of cancer has symptoms, but unfortunately in the mouth and the throat, a lot of times those symptoms don't occur until stage 4, where it's very almost untreatable. So very important. That's why it's an important part of my exam to do an oral cancer screen, is what we usually call it. That's where I'm feeling around and I'm looking around for things. We're taking the appropriate pictures to make sure that there is nothing there. There can be a lot of benign things. What the word benign means is it means that a lot of times there is a growth, but it's not a growth that will necessarily kill a person. It's the kind of growth that may get in the way of how they look. It might be some sort of mass over here that gets really big, but it's not actually going to kill them. That's what a malignant growth is. So anyway, this is a very interesting part of dentistry, very interesting to me. When we find, I usually find a few lesions, anywhere from probably 5 or 6 lesions a year, and probably 2 of those lesions actually, when I send them on to the oral surgeon and they get biopsied, which means it gets cut out and looked at under a microscope, it actually does turn out to be some sort of cancer. So that's why very, very important for us to do all these technological things, use all the tools in our toolbox in order to be able to diagnose these things, at least get them onto the right person that can do the biopsy and figure out what's going on. So So here's an example of, this is just kind of a little portion of that panoramic x-ray I was talking about. And I'm going to point my finger up here so you can see that whole dark area. Almost looks like part of the person's jaw was chomped out. And you can see at the top of that, it's actually showing destruction of the mandible, which is the lower jaw, by squamous cell carcinoma. So that is cancer. And basically what would happen is from probably all the way back here to all the way up here, they would actually have to section and cut out that whole jaw, rebuild it with some metal chains, essentially. Now, typically from the outside, it doesn't look too different. Surgery now can make people look pretty good, but that needs to be caught before it destroys any more of the patient's skull. So one of the last things kind of technologically to talk about is actually dental photography. Now, not too long ago, we didn't have our fancy smartphones, but my smartphone actually works great. I just have a Samsung Galaxy. I take a ton of pictures with my phone. If I'm trying to work on something as far as matching something that I'm making in the lab, and I can easily email the pictures immediately. I use with and without a flash, and I can hold up all of our shade tabs. This is what our shade tab looks like. But the big thing is having an eye for shade. Again, that comes back to the artistic component of being able to shade something. Now, most people's teeth are not the same shade. One tooth can have multiple different shades within it. The inside of the tooth is shaded differently. Some people's teeth are more see-through. So that's really, really important to have that sort of eye. And what those three things that go into color are called hue, chroma, and value. And I'm just going to kind of show you our shade guide so you can kind of see literally how many different shades we're working with and how we need to look at it under, I guess, fluorescent light. We need to look at it under natural light. I've taken patients outside before with our shade guide and held it up when they're out in the sunshine to make sure that we can get a spot on shade for something, especially that's going to be in the front of their mouth. So here are all the lovely shades that we have to work with. So you can see how it is a teensy bit complicated trying to match people's shades of their teeth. And then probably contrary to what most patients want, if we're having a hard time deciding between two colors, it's actually better to choose the darker color. If you choose a color that's too light, it will completely stand out from the rest of the teeth, as opposed to if we go to a shade darker when we're choosing in between two. So the last thing that I leave you with today, talking about the technology portion of dentistry, how do I do my job? Let's say if the power goes out. It is very difficult to do my job. And a lot of the things that we do, all our charts are internet-based. All of our x-rays, it's all digital now, all internet-based. I have had the internet go out before. Charter internet's not working. What do? We just have to go through our job without doing those things. And then we plan for the patient to come back later to get those pictures. Now, when electricity goes out, that's a lot more difficult. I have gone on mission trips to third world countries. I think I've been on 9 or 10. So a lot of times on those trips, I'm doing dentistry with no electricity. Obviously, I can't be drilling on teeth. I can't be doing fillings, but I can do extractions and I can clean teeth. So we kind of do with what we can. Now, obviously, that's not really happening too much in America. If all of our electricity went out, we'd probably cancel our day and send our patients home. But even our phones here are internet-based. So in this day and age, we rely so heavily on internet to work. So yes, it is very difficult to do my job unless we have all those things. We kind of go back to back in the day when there weren't those things to do our job well. It's awesome talking to you today. I will see you soon to talk about some other things, and I hope that this at least was somewhat interesting, and I hope I didn't bore you too much. And go start Googling dental pathology and x-rays. It's very interesting to look at. Just awesome. And we're going to talk about that a little bit more in some later sessions. So I hope you guys have an awesome day, and I'll see you soon. Bye.